If you're over 60 and experiencing bleeding, itching, or burning anywhere on your body, what I'm about to tell you could literally save your life. Here's what most people don't realize. After age 60, your body stops giving you gentle warnings. When something's wrong, these symptoms aren't just discomfort anymore, they're emergency signals. Recent medical data shows that 73% of serious conditions in people over 60 start with symptoms that patients dismissed as normal aging. The most shocking part? Many of these conditions are completely treatable when caught early, but become life-threatening when ignored. I'm going to share 7 critical warning signs that you must never ignore after 60. And the most important tip is at the end. Don't miss it, because it could be the difference between catching something early and facing a medical crisis. This isn't about scaring you. It's about empowering you with knowledge that could change everything. Too many people over 60 think that bleeding, itching, and burning are just part of getting older. That's not just wrong, it's dangerous. Your body at 60 and beyond is incredibly resilient and capable of healing, but only when you listen to what it's telling you and take action. The good news? Most of these warning signs, when addressed properly, lead to successful treatments and full recovery. How old are you right now? Write your age in the comments. I reply to everyone because your health journey matters to me personally, and I want to make sure you get the specific guidance you need for your age group. Let me start with rectal bleeding, because this is the symptom that sends the most people over 60 into a panic, and rightfully so. Any bleeding from your rectum after age 60 needs immediate medical attention, period. Here's why this becomes critical after 60. Your risk of colorectal cancer increases dramatically with each decade, and by age 65, you're in the highest risk category. The American Cancer Society reports that 90% of colorectal cancer cases occur in people over 50, with the majority happening after 60. But here's what's terrifying. Early colorectal cancer often has no symptoms except occasional bleeding that people dismiss as hemorrhoids. The difference is crucial. Hemorrhoid bleeding is typically bright red and occurs during bowel movements, while cancer-related bleeding can be dark, mixed with stool, or occur between bowel movements. If you see any blood, don't try to diagnose it yourself. Call your doctor immediately and insist on a colonoscopy if you haven't had one recently. I've seen too many patients who waited months thinking it was just hemorrhoids, only to discover they had advanced cancer that could have been caught early. Your action step right now. If you've seen any rectal bleeding in the past 6 months, even once, schedule an appointment this week. Persistent vaginal bleeding or unusual discharge after menopause is another red flag that too many women ignore. After menopause, your ovaries stop producing estrogen, and any bleeding should be investigated immediately. Postmenopausal bleeding occurs in only 4 to 11% of women, but when it happens, it indicates endometrial cancer in 10 to 15% of cases. That might sound like a small percentage, but endometrial cancer is the 4th most common cancer in women, and the average age at diagnosis is 62. The burning or itching that often accompanies unusual bleeding isn't just discomfort, it's your body's alarm system. Here's what makes this particularly dangerous after 60. Many women think occasional spotting is normal or related to hormone changes, but after menopause, there should be no bleeding at all. Even a small amount of bleeding could indicate cancer, polyps, or other serious conditions. The key is acting fast, because endometrial cancer caught early has a 95% 5-year survival rate, but that drops significantly if it spreads. Your immediate action, any postmenopausal bleeding, requires a same-day call to your gynecologist, and don't let anyone tell you to wait and see. Burning during urination combined with blood in your urine becomes exponentially more serious after 60 because your risk of bladder cancer increases dramatically with age. Most people assume burning urination means a simple urinary tract infection, and while that's possible, the combination of burning and blood after 60 requires immediate investigation. Bladder cancer is the 6th most common cancer in the United States, and the average age at diagnosis is 73. Here's the frightening reality. Early bladder cancer often presents with painless blood in urine, but when burning is present, it can indicate the cancer is more advanced or that there's significant irritation to the bladder lining. The challenge is that urinary tract infections become more common after 60, especially in women, so both patients and sometimes even doctors can miss the warning signs. But here's the critical difference. UTI symptoms usually include urgency, frequency, and pelvic pain, while bladder cancer bleeding might be the only symptom initially. If you have burning urination with any visible blood, even if it's just a pink tinge, you need a urine test, imaging, and possibly a cystoscopy within days, not weeks. Don't let anyone dismiss this as just a UTI without proper testing. Persistent itching and burning skin lesions that won't heal take on life or death importance after 60 because your skin cancer risk skyrockets with cumulative sun exposure and age. Skin cancer is the most common cancer in people over 65, with more than 3.5 million cases diagnosed annually in the United States. But here's what's truly alarming. Many people ignore itchy, burning skin spots thinking they're just age spots or dry skin. The reality is that basal cell carcinoma, squamous cell carcinoma, and melanoma all can present with itching and burning sensations. After 60, any skin lesion that itches, burns, bleeds, or changes in any way needs immediate dermatological evaluation. The most dangerous mistake I see is people treating persistent itchy spots with over-the-counter creams for months while skin cancer grows unchecked. Here's your action plan. Examine your skin monthly in good lighting, looking for any spot that's asymmetrical, has irregular borders, varies in color, is larger than a pencil eraser, or has changed in any way. If you find anything suspicious, see a dermatologist within 2 weeks. Take photos of concerning spots so you can track changes. Remember, skin cancer caught early has cure rates above 95%, but delayed diagnosis can be fatal. Burning chest pain or persistent heartburn after 60 isn't just indigestion. It could be your heart sending you a final warning. This is especially critical for women who often experience heart attack symptoms differently than men. After 60, your risk of heart disease increases exponentially, and what feels like heartburn could actually be cardiac-related chest pain. The statistics are sobering. Heart disease kills more people over 65 than all cancers combined. Here's the dangerous part. Many people over 60 have been dealing with occasional heartburn for years, so they dismiss new or worsening burning chest pain as just getting older. But cardiac chest pain often presents as burning, pressure, or squeezing, and it can radiate to your arms, neck, or jaw. The key warning signs are burning chest pain that occurs with exertion, lasts more than a few minutes, or is accompanied by shortness of breath, nausea, or sweating. Women especially need to pay attention because female heart attack symptoms can be subtle. Burning chest discomfort, unusual fatigue, or pain in the back or jaw. If you experience any burning chest pain that's new, different, or more severe than usual, call 911 immediately. Don't drive yourself to the hospital and don't wait to see if it gets better. Time is literally heart muscle when it comes to heart attacks. Persistent anal itching and burning, especially when accompanied by pain or bleeding, requires immediate attention after 60 because it could indicate anal cancer, a rare but serious condition that's increasing in frequency. Anal cancer affects about 2.5 per 100,000 people annually, but the risk increases significantly after age 60. The human papillomavirus is the primary cause, and symptoms often start as persistent itching and burning that people dismiss as hemorrhoids or irritation. Here's why this is particularly dangerous. Anal cancer symptoms are almost identical to common benign conditions like hemorrhoids or anal fissures, so both patients and doctors can miss the diagnosis for months. The difference is that anal cancer itching and burning typically don't respond to over-the-counter treatments and may worsen over time. You might also notice a lump near the anus, changes in bowel habits, or unusual discharge. The key is persistence. If you've been dealing with anal itching and burning for more than 2 weeks, despite proper hygiene and over-the-counter treatments, you need a medical evaluation. Don't let embarrassment delay your care. Anal cancer caught early has excellent treatment outcomes, but advanced cases require much more aggressive treatment and have poorer prognoses. Burning mouth syndrome combined with persistent oral lesions becomes critically important after 60 because oral cancer risk increases dramatically with age and cumulative exposure to risk factors. Oral cancer affects about 54,000 Americans annually, with the average age at diagnosis being 62. The burning sensation in your mouth, tongue, or lips, especially when combined with white or red patches, ulcers that don't heal, or persistent pain, could indicate oral cancer or precancerous conditions. Here's what makes this particularly dangerous after 60. Many people attribute mouth burning to dry mouth, dental problems, or medication side effects, all of which become more common with age. While these are possible causes, the combination of burning and visible changes in your mouth tissue requires immediate evaluation. Oral cancer can develop on your tongue, lips, gums, cheek lining, or throat, and early detection is crucial for successful treatment. The 5-year survival rate for early-stage oral cancer is 83%, but it drops to 39% for advanced cases. Your action step: examine your mouth monthly using a bright light and mirror, looking for any white or red patches, sores that don't heal within 2 weeks, or areas that burn or feel different. If you smoke, use tobacco products, or drink alcohol regularly, you're at higher risk and need even more vigilant monitoring. Let me bring this all together because your life might depend on understanding this crucial message. After 60, your body doesn't have the luxury of time when something's wrong. The bleeding, itching, and burning symptoms we've discussed aren't just discomfort. They're your body's emergency communication system. The biggest mistake people over 60 make is assuming these symptoms are normal parts of aging. They're not. Your body at 60 and beyond is capable of incredible healing and recovery, but only when you listen to its warnings and take swift action. The difference between a minor medical issue and a life-threatening condition often comes down to how quickly you respond to these warning signs. Remember, early detection and treatment dramatically improve outcomes for almost every serious condition we've discussed today. You're not powerless in this process. Your awareness, vigilance, and willingness to seek immediate medical attention when these symptoms appear can literally save your life. Don't let fear, embarrassment, or the assumption that symptoms are just aging prevent you from getting the care you need. Every day you wait with concerning symptoms is a day that could make the difference in your prognosis and quality of life. If this information helped you understand the importance of these warning signs, please hit the like button and subscribe for more life-saving health content specifically designed for people over 60. Turn on notifications so you never miss crucial health information that could impact your life. Share this video with friends and family members who need this information. You might be saving someone's life by spreading this knowledge. Which of these warning signs surprised you the most? What other health topics do you want me to cover for people over 60? Leave your thoughts in the comments below. And remember, I read and respond to every single comment because your health journey matters to me personally.